Hi, my name is Dr. Ashley Gearhardt, and I'm the director of the Food and Addiction Science and Treatment Lab at the University of Michigan. And I'm happy to speak with you today about our research that demonstrates parallels between ultra-processed foods and addictive substances. I think the first thing to keep in mind when considering these parallels is how we traditionally create all addictive substances. They're really not found in nature. Addictive substances are man-made creations that we make by taking something that is naturally occurring, like a tobacco leaf or a coca leaf or some fruit, and we process and refine it and so that it rapidly delivers a high dose of rapidly absorbed reinforcing substance into the system. And that profile really seems to trigger our motivation and reward systems in a way that for some people, they can start to lose control and consume the substance compulsively, even if they want to stop, even if they want to cut down, even if they know that they have a life-threatening health condition. And so when I look at our food supply and how it's changed over the last 1,000 years, but particularly since the late 1970s, what I've seen is that we've gotten technology that's been really good at cheaply and effectively refining out carbohydrates and fats from naturally occurring foods like fruits and nuts and meats, and taking these potent, refined, distilled, rewarding food substances and then combining them into thousands upon thousands of different ultra processed food products. And these food products deliver in a naturally high dose of carbohydrate and fat at a rate that's more rapid than we see in real food, because real food often has fiber and water and protein, and it takes a little while to eat and it takes a little while to digest and absorb. When you take something like a handful of jelly beans relative to a banana, how quickly you can eat that, chew that, absorb it, and how rapidly it hits your gut and then your brain, the sugar in that is much more potent and powerful. And so, as we've refined these food-like substances, these ultra-processed foods, to be more and more rewarding, we've also developed them to be more shelf-stable, more novel, to be heavily marketed and to target kids. And all of these approaches really come from the playbook of tobacco. And that really shouldn't be surprising to us because Philip Morris and R.J. Reynolds bought up food companies beginning in the late 1970s and 80s when the tobacco industry was coming more under threat. The portfolio was diversified by buying up companies like General Mills and Kraft. And there's evidence that has been published that the tobacco owned food companies were able to come in and apply the playbook they knew about how to sell an addictive substance very effectively by targeting kids and enhancing flavors and targeting communities that were more vulnerable, like racial and ethnic communities that were more stigmatized, and really focusing on them to sell the product. And there's evidence that they took all of those approaches and applied them to their food holdings. So as our food system of now dominated by ultra processed foods have been shaped by big tobacco, that's really when we've seen this huge uptick in obesity, diet related disease, and compulsive overeating. And when we look at the hallmarks of addiction, when we look at how do we try and understand whether somebody's a social drinker or really have an addictive relationship with alcohol, we look at behavioral markers like a loss of control over intake, continued use despite negative consequences, intense cravings, feelings of withdrawal like anxiety and agitation and depression when you try and cut down, and tolerance where you need kind of more and more of that substance to get the same fix of reward. When we look at those core hallmarks of addiction, we see all of those showing up across kids, teenagers, adults, older adults, when it comes to their relationship, specifically with these common ultra processed foods, foods like chocolate and ice cream and French fries. We do not see that sort of hallmarks of addiction showing up with foods like fruits and legumes and veggies and lean meats, that people don't seem to really develop this addictive relationship with foods that our brains evolved to handle. And these ultra processed foods truly have more in common with a cigarette than they do a food that was created by Mother Nature. And that's been a huge public health crisis for us.